it's a great honor to introduce a very good friend and somebody who's worked diligently in many different fields, a graduate of Georgetown Law Center. He has served as the solicitor of the U.S. Department of Labor, as a senior advisor to the Secretary of Labor. He has served as a senior investigator in the Congress, looking at government programs and efficiency, things that go right and things that go wrong. Very intelligent guy, very loyal. He's been around a kidney patient. We've worked together before, but he is the chief of staff of one of the most influential departments in government, the U.S. Department of Labor. It literally touches everybody's life, every employer in America and every employee. His name is Gill, and Nick is here to make a special announcement of an action that the Secretary and the Department of Labor chose to take regarding the Family Medical Leave Act in its application to organ donors. So without further ado, Nick, come on up.
Thank you for that very warm welcome, and I want to thank Paul personally. Little known fact, I now sit in the same office that Chief of Staff Conway did during the Bush administration for Secretary Elaine Chao. Paul first interviewed me about 12 years ago and hasn't been the same since for either one of us. He's a true friend personally, and I know he's a true friend to everyone in this room. It's really an honor to be here today with the American Association of Kidney Patients and to speak to this audience of patients, patient advocates, industry leaders, and medical professionals. I would like to personally honor AAKP and their 50th anniversary and their role as the largest independent and patient-led kidney patient organization in the United States. That's an amazing run of history, and it was a pleasure to hear Paul's story about the beginnings. Today in America, there are more than 40 million Americans living with kidney disease, and nearly 700,000 living with kidney failure, of which there is no cure. The cost of this disease to patients, their loved ones, and caregivers is incalculable, and the cost to the taxpayer is nearly $100 billion per year. Over 100,000 Americans are on the kidney transplant waiting list, and the waiting list, unfortunately, continues to grow. One of the barriers to increasing living organ donations has been the vagueness in some instances surrounding the application of the Family Medical Leave Act as it applies to organ donors. This barrier has been identified by many stakeholders in the kidney community, from the National Kidney Foundation to the American Society of Nephrology to you guys here today, America's largest independent kidney patient organization. Ironically, in a colloquy among the original sponsors of the Family Medical Leave Act, the issue of organ donation was discussed, and it was stated that the intent of the bill was indeed to cover organ donors. At the time the legislation was passed, the record therefore shows those who voted for the bill envisioned job protections and 12 weeks of unpaid leave for organ donors. The Department of Labor is aware of a separate effort to address the issue of FMLA applicability through the legislative process versus via the Living Donor Protection Act, a good piece of legislation that I know you have had input on. This piece of legislation has 70 sponsors in the House of Representatives, and we appreciate and applaud stakeholders' involvement from the kidney community in advocating for and helping develop this legislation, particularly the patients who know what it's like and know what needs to be done in order to make sure they have the opportunity to live a full life. And it is important that you tell your stories to Congress and advocate for what is needed in this instance. The department respects that legislative process and our role as the administrator of the laws that the Congress passes. The Secretary of Labor had the opportunity to review this issue fairly recently under the authority given to us under the laws that Congress has passed. The department recently relaunched a compliance assistance tool known as opinion letters, which were originally created by Congress, and unfortunately the prior administration ended them following decades of use by both parties throughout the government for many years. These are incredibly important tools in order to allow stakeholders to solicit the department's views on discrete facts and circumstances and how the law would apply in those instances. On August 28th of this year, the department issued an opinion letter under the Wage and Hour Division of the department, which enforces the Family and Medical Leave Act. The department's letter, which I will read from momentarily without the legal boilerplate on both ends of it, so as not to bore you, address the issue of whether the FMLA extends to organ donors while they are receiving inpatient or continuing treatment. Kind of a no-brainer here legally, if you ask me, and surprising that it took this long to address. More importantly, there's no reason why Americans who are committed to a noble and decent act, giving a part of themselves to save another life, should be denied the job protections extended to so many others under the Family and Medical Leave Act. We believe every good employer agrees with this conclusion and should have no problems in supporting this decision either. Consistent with the goals of the President and the Secretary to review opportunities to advance the interests of both workers and patients, we have taken this action. We believe the removal of a barrier to organ donors will help professional, medical, and patient advocacy organizations, as well as the government, be more effective in encouraging our fellow citizens to consider giving the gift of life. I'd like to read from our letter now. This is posted on our website if you want a copy. I think Paul can distribute it. You inquire whether an employee who donates an organ can qualify for FMLA leave even when the donor is in good health before the donation and chooses to donate the organ solely to improve someone else's health. You also inquire whether an organ donor can use FMLA leave for post-operative treatment. You note in your letter that organ donation surgery typically requires an overnight stay in a hospital. The Family and Medical Leave Act entitles eligible employees of covered employers to unpaid, job-protected leave for specified family and medical reasons. Eligible employees may take up to 12 work weeks of leave in a 12-month period for, among other things, a serious health condition that renders the employee unable to perform the functions of his or her job. An employer may request medical certification from a healthcare provider concerning the serious health condition, and that is the basis of the Family and Medical Leave request. When requested, medical certification is a basic requirement for FMLA leave for a serious health condition, and the employee is responsible for providing that certification. The FMLA defines serious health condition as an illness, injury, impairment, or physical or mental condition that involves either, quote, inpatient care in a hospital, hospice, or residential medical care facility, or, quote, continuing treatment by a healthcare provider. Implementing regulations define inpatient care as an overnight stay in a hospital, hospice, or residential medical care facility, including any period of incapacity or any subsequent treatment in connection with such inpatient care. The regulations also specify that continuing treatment includes incapacity in treatment, chronic conditions, permanent or long-term conditions, and conditions requiring multiple treatments. For all conditions, incapacity means inability to work, attend school, or perform other regular daily activities due to the serious health condition, treatment therefore or recovery therefrom, and treatment includes examinations to determine if a serious health condition exists and evaluations of said condition. An employee is incapacitated if he or she is, quote, unable to work at all or is unable to perform any one of the essential functions of the employee's position, including when the employee, quote, must be absent from work to receive medical treatment. An organ donation qualifies as an impairment or physical condition that is a serious health condition under the FMLA when it involves either inpatient care or continuing treatment. Thus, as relevant to your request, an organ donation qualifies as a serious medical condition whenever it results in an overnight stay in a hospital. Of course, that is not the only means for organ donation to involve inpatient care or continuing treatment. Organ donation surgery, however, commonly requires overnight hospitalization, as you note in your letter, and alone suffices for the surgery and post-surgery recovery to qualify as a serious health condition. End quote. That letter was solicited under our new Compliance Initiative program. We encourage everyone in this room, if you have additional questions under the FMLA, under any other statutes as well, to solicit input from the department. We are proud of the fact that we work with the regulated community, both employees and employers, to provide the best information we can, to conduct outreach, and to make sure that we serve to the fullest extent possible as a source of information and support, as well as a listening location, and we provide technical assistance to the Hill on FMLA when they have desires to make amendments. And we are very much honored to be here today and to support you in your important mission. And I want to thank Paul for his very kind gesture in offering the opportunity to be here today and make this announcement. So thank you very, very much.
Again, it's an honor to have top lawyer, U.S. Department of Labor, but somebody who actually understands our issues and what we deal with. So again, one more round of applause, and we appreciate his presence.